Hello, everyone. Welcome to another episode of 2-Minute Emergency. Welcome also to Women's Health Month. I am your host, Dr. Leslie, board-certified emergency physician, best-selling author, international speaker, and professional photographer. And I bring you information to help keep you healthy, safe, and out of the emergency department. So what is the topic for today? Today's topic is specifically for the women, dysfunctional uterine bleeding. So it's also known as DUB. We like little acronyms. What is the importance of dysfunctional uterine bleeding? So typically, what it's described as is when you have bleeding either in excess or less than your normal period. In other words, an irregular period, and oftentimes it has nothing to do with ovulation. So we're more concerned, especially in those people that have spotting, either up to 21 days before their period, or if they have increased bleeding, cramping, and there's a lot of other symptoms that can be associated. So first off, when this occurs, there are some things that you need to think about. It's typically associated with changes in your hormones. That being said, there's a lot of different things that can cause those changes. One of the most common is thyroid disease, whether it's hypothyroid or hyperthyroid. There are also things that can cause it, such as birth control pills, because keep in mind, they're adding different hormones to our bodies. Now, there's something extra to be said about those birth control pills because they're also used to treat dysfunctional uterine bleeding. But let's talk about some other causes. Another is something called endometriosis. And endometriosis is when that typical uterine lining actually grows outside of the uterus. Most commonly, this happens around the ovaries, but it can literally happen anywhere in the abdomen. So that's going to cause typically more cramping and, of course, bleeding as well. Other things that can cause dysfunctional uterine bleeding may include stress. It may include changes in the pituitary gland, which is in the brain, because that has a lot to do with regulating our hormones. And something like a tumor on the pituitary gland can cause this. Other things that can cause it are sexually transmitted diseases. Yes, absolutely. Things like chlamydia, gonorrhea, they cause inflammation of the uterine lining and can cause bleeding at times apart from the period, especially with intercourse, and can also be very painful, in addition to all the other things that it can cause. Other things that can cause it, let's see, PCOS, polycystic ovarian syndrome, when you have it's exactly what it sounds like. You have multiple cysts on the ovaries, and they, of course, are going to play into the changes in hormones again, change that uterine lining, and cause increased heavy bleeding. So if you see that you are having periods that are more painful than usual, a lot of clotting going on, if you have, as I said, spotting in between your periods, or your periods are lasting a lot longer than usual. So if your typical period is anywhere between 3 and 5 days, day 7, you're still going, that needs to be investigated. The reason why is not only can it lead to things like anemia because of the loss of blood, but out of women that don't get this investigated, up to 2% can actually have uterine cancer. So it's not something we just need to blow off and say, it'll stop eventually. Yes, one way or another, all bleeding does stop eventually, but the importance is finding out what's the cause of it. So other things that are used to treat it, I mentioned birth control pills. So birth control pills have a combination of hormones, but we can also use things like estrogen and progesterone separately to take care of dysfunctional uterine bleeding. Now, many of these things easily followed up with your family practitioner or your gynecologist. In the emergency department, we're going to be concerned about those people who have had excessive bleeding to the point where they have additional symptoms. So dizziness, weakness, fainting, pale skin, elevated heart rate, low blood pressure. Those are the times where you need treatment quickly. That is not a time to just call your doctor and wait a week. I'm not saying doctors take a week, but wait time for your regularly scheduled appointment, anything like that. You need to be seen and evaluated. So these are some of the things to keep in mind. We're always going to be concerned about the worst possible scenario, and it may be something very simple, but it is important to get these investigated every time. So I hope you found that information helpful. And Karen, thanks for joining me here today. I hope you learned something through this small talk on my 2-minute emergencies. So once again, I am Dr. Leslie, board certified emergency physician, best-selling author, international speaker, and professional photographer. And I bring you information to keep you healthy, safe, and out of the emergency department. So until next week, stay safe. Bye for now, and I'll see you later.